When people think of coffee, they usually think of its ability to provide an energy boost. However, according to some research, it can also offer some other important health benefits, such as a lower risk of liver cancer, type 2 diabetes, and heart failure. Worldwide, experts estimate that people consume around 2.25 billion cups of coffee per day. Researchers have looked at the benefits of drinking coffee for conditions such as diabetes, cardiovascular disease, inflammatory bowel disease, and liver disease. Coffee contains a number of useful nutrients, including riboflavin, vitamin B2, niacin, vitamin B3, magnesium, potassium, and various phenolic compounds, or antioxidants. Some experts suggest that these and other ingredients in coffee can benefit the human body in various ways. 6 health benefits of drinking coffee. 1. Reduced risk of type 2 diabetes. Increasing coffee consumption may reduce type 2 diabetes. The researchers found that the participants who increased their coffee intake by more than 1 cup a day, on average, an increase of 1.69 cups per day, over a 4-year period had an 11% lower type 2 diabetes risk over the subsequent 4 years, compared with people who did not change their intake. 2. Decreased risk of heart disease and stroke. Type 2 diabetes alone makes heart disease and stroke more likely, and coffee has also been linked to lower risks for heart rhythm disturbances, another heart attack and stroke risk factor, in men and women, and lower risk for strokes in women. A study of 83,700 nurses enrolled in the long-term nurses' health study found a 20% lower risk of stroke in those who reported drinking 2 or more cups of coffee daily compared to women who drank less coffee or none at all. That pattern held regardless of whether the women had high blood pressure, high cholesterol levels, and type 2 diabetes. 3. Less likely to develop Alzheimer's and Parkinson's diseases. If you're an older adult, those extra cups of coffee you drink on a daily basis appear to definitely have an extra perk beyond keeping you alert. A study monitoring the memory and thinking processes of people older than 65 found that all those with higher blood caffeine levels avoided the onset of Alzheimer's disease in the 2 to 4 years of study follow-up. Moreover, coffee appeared to be the major or only source of caffeine for these individuals. Coffee consumption has also been shown to not only reduce the risk of Parkinson's disease, but to also help with movement symptoms for people who already have the disease. 4. Source of antioxidants. Although fruits and vegetables are generally promoted as good sources of antioxidants, the new finding is surprising because it represents the first time that coffee has been shown to be the primary source from which most Americans get their antioxidants, Vincent says. Both caffeinated and decaf versions appear to provide similar antioxidant levels, he adds. While this finding doesn't really say good things about Americans and our diets in general, I did find it fascinating that coffee is the primary source of antioxidants in our overall diets. 5. Decreased depression risk. Among women, drinking coffee may reduce the risk of depression. The researchers found the risk of depression to be 20% lower among women who drank 4 or more cups of caffeinated coffee than those who drank little or none. Those who drank decaf, tea, soft drinks, chocolate and other beverages containing less caffeine did not appear to be protected against depression. 6. Increased brain power. CNN reported that although caffeine cannot actually make you smarter, it does allow you to use the brain power you already have in a much more efficient